Ever get that feeling? Like you just want to cut through all the noise and like instantly get what's important.
Yeah, absolutely.
Well, that's exactly what we're going for today. We're diving deep, no nonsense, into the minimum inhibitory concentration, or as it's better known, MIC.
A classic.
Our mission today, should we choose to accept it, is to become, well, informed and rapidly about this really critical tool. It's all about how we understand and fight off those tiny but mighty microbes.
Yeah, and we've actually got some great info here that, unpacks what MIC is really all about. So by the time we're done, you'll have a good grasp of its core meaning and why it's so crucial, especially for like gauging how well our antibiotics actually work against those pesky bacteria.
Perfect. All right, so let's start with the basics. What exactly is this MIC we keep mentioning?
Okay, so at its heart, the MIC, right, minimum inhibitory concentration, it's the lowest concentration of an antimicrobial. Think like an antibiotic. And it's the lowest amount that stops a specific bacterium from visibly growing in the lab. And that's what we call in vitro.
In vitro, got it.
Meaning in a controlled lab setting.
Okay.
And this is all checked after a standard incubation period, usually like 18 to 24 hours. Now, you'll typically see MIC measured in micrograms per milliliter, sometimes milligrams per liter. But what's really fascinating is that this pretty simple measurement is actually the first step to understanding a drug's potential.
Okay, I see. So it's like a first look at how powerful an antibiotic could be. So then how do scientists actually figure out this MIC value? Are there different methods or what?
Oh, yeah, definitely. There are 4 key methods that are used. The first one is called broth dilution. And think of it like this. You're basically creating a series of increasingly diluted antibiotic solutions, but in liquid broth. So bacteria are added to each of these solutions, and the MIC is then the lowest concentration where that broth remains clear, meaning no bacterial growth, no cloudiness. Which that's also called turbidity.
Turbidity, right, like cloudy. Makes sense.
Exactly. And this tells us the drug's direct inhibitory power in a liquid environment.
Got it.
And it's often done in small well plates for efficiency. That's called microdilution. And sometimes we can even go a step further to find the minimum bactericidal concentration, or MBC for short. And this one actually kills the bacteria, whereas MIC just stops the visible growth.
I see. So it's like going from stopping growth to actually wiping them out. So, okay, we've got this liquid broth method. What's another way to find MIC?
Okay, next up is agar dilution. So instead of using liquid, here we mix the different antibiotic strengths directly into agar. That gel-like substance in Petri dishes.
Yep, I've seen that in the lab.
Yeah, so we place spots of bacteria on each plate, and the MIC is, again, the lowest concentration where no bacteria actually grow. And this method is really useful when you need to test like a lot of different bacterial strains at the same time. It's good for large-scale testing.
All right, so we've got liquid, we've got this gel. What other tools are in our MIC toolkit here?
Well, then we have something called the gradient strip method, which is also known as an E-test.
Okay, an E-test.
Yep, so picture this. You've got this plastic strip, right? And it has a continuous gradient of antibiotic concentration along its length. And you place this strip on an agar plate that's already been, covered with bacteria. So as the antibiotic diffuses out from the strip, it creates this sort of elliptical zone where, the bacteria can't grow. So the MIC is basically read directly off the strip, right where the edge of this clear zone meets the printed scale on the strip. It's actually a pretty direct way to get the MIC measurement.
That does sound super practical. And what about the last method?
Right. So lastly, we have automated systems. These are basically commercial instruments that are designed to completely automate the broth microdilution process, that first one we talked about.
Ah, okay.
And they're pretty amazing. I mean, they can detect bacterial growth extremely quickly and in a very standardized way by measuring things like changes in cloudiness or sometimes even fluorescence.
Yeah.
And this allows for, really high throughput testing. Like we can test a ton of samples and we're also going to get very consistent, reliable results.
So that's amazing. So we've got all these different really neat ways to find this MIC value, but why is it so important in the real world? Like, how does this actually help us?
This is where things get really interesting because the MIC provides really crucial guidance for doctors, especially when they're choosing the right antibiotic and the correct dosage for a specific patient and their infection.
Okay, so it's not a one-size-fits-all kind of thing?
No, definitely not.
Yeah.
So generally speaking, a lower MIC value indicates higher potency, meaning the antibiotic is more effective at lower concentrations.
Makes sense.
But even more importantly, tracking how these MIC values change over time for different bacteria is absolutely vital for monitoring antibiotic resistance.
Oh, right.
Because even a small increase in the MIC for a common bacterium can actually signal that a previously effective antibiotic is, starting to lose its power. And this has huge implications for public health, obviously.
So it's not just about picking the right antibiotic in the moment. We also need to keep an eye on how those bacteria are changing and potentially becoming resistant.
Exactly. It's a constant battle. And, in drug discovery, MIC testing is like fundamental for evaluating how well these new potential antibiotics actually work against those pesky bacteria.
Right.
So if researchers find a new compounds with a significantly lower MIC, well, it's not just like a better number on paper. It could actually mean that lower doses of the drug are needed, which could potentially reduce side effects for patients.
That's great.
Yeah, and furthermore, the MIC is a key element in what we call PKPD studies.
PKPD studies, what is that?
So it stands for pharmacokinetic pharmacodynamic studies. It's a mouthful, but essentially these studies they help us understand how the drug levels in the body relate to their actual effectiveness. And so MIC data helps inform optimal dosing strategies, like how much drug do you need and how often do you need to take it to get the best results.
Okay, so it's all about maximizing the drug's effect while minimizing the downsides.
Exactly.
Now, earlier you mentioned that a lower MIC is generally better, but our sources also talk about these things called clinical breakpoints. How do those fit into the picture?
Ah, that's a good point. So an MIC value all by itself, it doesn't give us the full clinical picture. So that's where organizations like CLSI, the Clinical and Laboratory Standards Institute, and UCASC, the European Committee on Antimicrobial Susceptibility Testing.
Wow, those are some long names.
They are. Haha.
I
Anyway,
see.
they basically establish what we call clinical breakpoints.
Clinical breakpoints.
Yeah, then these are essentially MIC thresholds that help us categorize bacteria. Like, are they susceptible to this specific antibiotic at a normal dose? Are they intermediate, which means maybe we need to give a higher dose or consider other factors? Or are they straight up resistant, meaning this antibiotic probably won't work even at high doses? And these breakpoints don't just consider the MIC alone. They also take into account, how the drug behaves in the body, any known resistance mechanisms, and actual clinical outcomes.
So it's like taking the raw MIC data and putting it into context, right? Like figuring out what it really means for treating a patient.
Yeah, exactly. So a bacterium with a specific MIC value, it might be considered susceptible to one antibiotic, but totally resistant to another. And it all depends on these clinical breakpoints. They help us interpret the raw MIC value and give us that meaningful clinical context, telling us the likelihood of the treatment actually succeeding.
It's like translating the lab results into real-world treatment decisions. So basically, the key takeaway here is that the MIC is this core quantitative measurement in the lab, but it helps us understand in a really precise way how an antimicrobial drug is going to actually work.
Absolutely. And, once you understand what MIC is and how it works, it gives you a much deeper insight into the complexities of treating bacterial infections
Yeah.
and also the constant challenges we face with antibiotic resistance.
Right, and I think that's a key point because this whole thing with MIC, it might seem like just a number, but it actually underpins so much of how we approach fighting infections, which affects all of us. So as we wrap up, I have a question for you.
Sure.
Since we've seen how this seemingly simple measurement can drive so many critical decisions, what other, maybe seemingly basic measurements are out there? What else is silently driving those like huge decisions in science and medicine, all around us? Something to think about.